Even this first day of MBBS, you enter upon 150 people. You're so intimidated. You do not know what is next, what fathom of place you've reached.
It's on Instagram page. So we have received a few DMs from fellow doctors.
It's how you take on every failure, whether you take it on as a burden or as a learning experience. Nightmares, I really don't know. That's only time will tell. But I feel that whatever super specialization is there, it all depends on your willingness to get stratified into a particular field, into a particular branch.
Hello everyone, I am Dr. Roshni, your host, and I welcome you to yet another episode of MSc Goa's The Podcast Show. Today we will be discussing about a branch that is considered as the backbone of surgical care. Yes, you have guessed it right, it is general surgery. However, today it is so difficult to find a general surgeon in this era of rapid super specialization, as more and more doctors are down their focus into highly specialized fields. An important question arises. What impact does this shift have on general surgery as a PG branch, on patient care and healthcare system as a whole? Today, we will dive deep into this changing landscape and learn from a very experienced general surgeon. But before we begin with our today's episode, we would like to thank our partners, Aesthetic DNA, a place where patient care feels personal and beauty feels natural. At Aesthetic DNA, every smile, every concern and every goal matters. From the moment you walk in, you are welcomed into a warm, calming space designed to help you feel relaxed, safe and truly at home. We believe no two people are the same and neither are their needs. That's why our treatments are never one size fits all. We take the time to listen, understand your story, and gently design a plan that's tailored just for you. Your comfort, confidence, and well-being guide every decision we make. Here, science meets compassion and expertise meets kindness. Whether you are here for a subtle refresh or a confidence boost, you will be cared for with honesty, patience, and heart. At Aesthetic DNA, it's not just about how you look, but it's about how you feel too. Our today's guest is none other than Dr. Frazer Rodrigues, a general surgeon practicing in Goa with special interest in treatment of diabetic foot. He is an alumnus of GOMECO and a batch 2011, having completed his post-MS surgical practice. So, welcome to this podcast.
Thank you for having me here. I thank the team MSc for giving me an opportunity to be present on this forum to be helpful in guiding multiple questions that patients, doctors, and young students face today.
That's nice. So, first of all, we would like to know what motivated you towards MBBS, MS General Surgery. Basically, what has led you to where you are today, your journey?
So this story goes way back. One day when I was in the ward as a second generation surgeon, I was waiting for my father to go for a function. And as I stood out of the duty room, I was encountered by an old man who told me, "Are you Dr. Ju's son?" So to that, I replied, "Yes." He said, "It is because of him that I am alive today." And that's what made me think on how to save a life. And the importance that we doctors have in touching every person's life.
That's so. We would like to know how does practicing surgery in Goa differs from other parts in India.
So we in Goa have got a local cultural heritage in which Goa being such a small state, we have so many resources at our disposal that even the remotest of patients can reach the tertiary primary healthcare, secondary healthcare, and even tertiary care within 1 to 2 hours. And that's robust care is what defines us from other metropolitan cities. Although in other metropolitan cities, you have various new innovations and new technologies, even doctors with highly specialized care. But in Goa, we concentrate more on holistic approach and making sure that we cater to even the general public and treating, and in my personal profession, treating surgery with a holistic surgical approach rather than a mirrored approach towards a particular problem. Another thing I'd like to add is that from in Goa, we have a lot of people who come from the remotest parts who neglect their healthcare and approach us in various needs quite late. So it's important for a surgeon not only to be a surgeon but to be an educator and also a clinician.
Yeah, definitely. So, as we were discussing in the beginning, that nowadays many of the general surgeons are inclined towards super speciality. So, how does this shift change has an impact on general surgery as a PG branch, patient care, and healthcare system in overall?
Coming to distinguishing each and every concept of what you just said, I'd like to state that I know that a lot of people are getting streamlined and getting focused into a particular branch, which is good. But as a general surgeon, I would not like to diversify this option and make sure that every individual requires a holistic approach. Coming to super specialization, for the young doctors out there, it is good that people who are very focused, driven, and only want to narrow themselves into a small faculty will cater to super specialization and work hard towards it. But in Goa, we require these super specialists to come back and improve our healthcare. On the other hand, it is important to get adequate general surgical training that is not seen with everybody. And that is why even in my practice, I wanted to complete my 3 years of post-MS residency, senior residency, sorry. And that's how that improved my whole outlook towards patient care and gave me a vast experience to multiple different categories of patients that we received in terms of diabetic foot disease, general abdominal conditions, and also specialized laparoscopic care.
So, take us back to that time. Growing up in Goa, what inspired you to take up MBBS and general surgery later?
So, as I remember in my schooling days, I was a very avid learner. I would continuously want to know why this has happened, what should be the next step. Even opening up a simple mechanical technological thing, I was always interested in learning the mechanics of everything that I did, and that nicknamed me from school as Dotor. So that's why I this continued into my higher secondary days, and I participated in the Vrindavan Health Quiz. And learning for the Vrindavan Health Quiz, it opened up so many parameters of the human anatomy to me, and I never knew that human medicine had so many aspects. Coming back to that, I was always interested in continuous learning, which is medicine in short. So that's why I picked up medicine as an option for my bachelor degree. And coming to MS, now that was a tough choice because, as you know, there are so many specialities. And thinking ahead, you want to know what you have an aptitude towards. So when I chose, even till the last day, which is very confusingly, that I was still very quite confused between general surgery and even MS OBG. But
Okay.
my opportunity to grow and to touch each and every organ, to be able to feel, and that is only present in general surgery. So being a backbone of every super specialty, I feel general surgery does take a lead in everything.
Yes, very well said. So, GOMECO has shaped generations of doctors. How did your posting, how your residency as a MS surgery and post your residency, how did that mold you as a doctor?
Coming to my residency training, from first year, second year, third year, it brought me multiple experiences. And yes, I did learn more from other people's mistakes than my own. As you know, that residency is tough, it's hard, not because it wants to be rough on you, but because the whole experience of emboldening you to face the challenges of human life in your hands is important. So that's why it's important to know about teamwork. You, the nursing staff, the paramedics, the anesthesiologist, everyone forms a team to get the patient their care. To the extent that sometimes it requires you to, like they normally say, you've got to push trolleys, you've got to sometimes clean the floors, which is true, but that's all because you care for the patient and you do not want that extra, you want to put in that extra effort so that the patient does not suffer, the patient does not get an infection. And that's what really is important and is what caters to how every individual, every surgeon should think that yes, it is, we are here for patient service, we are here for the individual.
So, moving on, diabetes is increasingly common in Goa due to the lifestyle changes. So, you have a special inclination towards diabetic foot care. Why is this area so critical?
Now, if you go to see today, how many people in Goa have got diabetes? Goa being such a small state, we have a numerous people suffering from the complications of diabetes. And these complications can be avoided if only people are caught at the right time, primary and primordial prevention. And that too, this is important because simple foot care, noticing the signs of diabetes, neuropathy, all this can benefit the patient, and also it teaches the doctor how to improve their knowledge and their lifestyle changes of the patient. It's important to know that a single shoe does not fit all sizes. So hence, each patient requires a tailored approach towards getting his diabetes under control, his diabetic footwear, his, if he has got diabetes foot already, to prevent further complications like gangrene, amputations, and others.
Yeah.
That's why I chose diabetes as a subspecialty interest for all my patients that I prescribe and that I see, so that I can make a simple change to their lives. It is not out of fear that I'm changing their lives. It is out of experience, and it is out of telling them what is the importance and what they should not. Like every patient in the ward or every patient that comes to my clinic, it is very difficult to tell them that no, this is what has happened, this is what can happen, because then that creates that inherent stage fright from the doctor, which they will then go ahead and neglect themselves. So to prevent that, I try to tell them that no, you can make a change. Today is not your last day. Tomorrow can be better for you if you follow these principles. Not this is what will happen if you do not do this.
Yeah. So, having said that, people, especially in Goa, they rely on home remedies and delay consultation. So, how do you build that trust and educate these people that about? So, how do you work towards building the trust and educate these patients?
Important to treat the whole situation that the patient is suffering. Number one, you tell them what are their daily practices, what are their nutritional needs in front of their caregiver. Because sometimes the patient comes, the caregiver is not there, or the caregiver comes and the patient is not there. So that rapport that you create has to be continued at home, and it is very demanding. Like how we say cancer is also similar, wherein the patient caregiver is also drained off. Diabetes may also be financially draining, but also mentally, because living with a diabetic foot, it is a long prolonged treatment, and this is what is important to be stopped at the early stage, from nutrition to good care to understanding the pathology, the biomechanics of the foot, and how important is the role of the caregiver to the patient. So for all my fellow colleagues out there who are seeing diabetic foot, it's not only doctors, even allied health facilities, nurses, they can pick up diabetic foot at a very budding stage and treat them if not, because knowledge is key, and knowledge is time, time is money.
Of course. Many medical students and young doctors look up to professionals like you. So, what advice would you like to give them?
Now, the advice I would like to give all my fellow colleagues, students, doctors, it's very easy to get disheartened among small failures. We should not be so hard driven for success. There are ups and downs in every bit, every field, every profession. It's always important to know that the defense to understanding any situation is how to overcome it. be it the PG lifestyle, be it doctors, be it a surgeon's life in particular, you should always try to see the silver lining in every cloud. And that's what I want to tell all my colleagues and my friends out there, that do not get disheartened. There are two ways you can look to any problem. Either one way you think about it and see what went wrong and try to improvise yourself, or in the second step is negative criticism, in which you say the world is not for me and I'm not for this. Maybe I'm not meant for a particular profession or something like that. So rather than that, it's always what you can learn from every instance, every simple ward interaction with your patient, every OT interaction. And a similar thing like what I would say that I've seen in my clinical practice, the little joys you can give to even a lipoma removed in your minor OT can make a difference, because that patient will come and will be thankful to you for the rest of her life. And that's why general surgery is a profession that is so yearning, demanding, but also rewarding.
You just made me think about my initial internship in surgery.
That's exactly what I was going for. Going back to my residency and my choice of continuing with MS General Surgery and my 3 years of post MS senior residency, I recall the toiling years that I spent in the OT, under the OT lights, and it was very rewarding that after 24 hours, 48 hours, the experience that you get and the opportunity of seeing that patient back in the ward, either from an intestinal obstruction or from amputation. It is important that we understand that life is fragile. And in today's world, it's important that we focus on how exactly we can do good to people and change the landscape of Goa in terms of the healthcare, as well as touching each and every household life through a small incision and a scalpel. I recall certain incidences from my general surgery practice also, in which there was a patient who has come with multiple things perforated up into the rectum. God knows how that has reached there, but fascinatingly, it was fun to remove that. Even the number of surgeries that we have done in trauma, with patients coming with falls, injuries, and making sure that these patients deserve the adequate care that they receive.
So you actively engage in leadership and social services, co-curricular activities as well. You are also in the advisory committee of MSc Goa. So why is it important for doctors in Goa to step beyond the hospital?
I would say that doctors in Goa, once they start, even the first day of MBBS, you enter a hall with 150 people. You are so intimidated. You do not know what is next, what fathom of place you have reached. Seeing teachers come in, giving you lectures, going out, things going above your head. The only thing that keeps you sane are these extracurricular activities. May it be student council, may it be the residency council, may it be the simplest acts of conducting sports and engaging into activities, or even going for a movie with your friends. You require this space beyond the tremendous hours of mental stress and duress that you get to overcome by these practices. So that's why I feel that for me personally, it's what kept me going and kept that part of me alive in terms of doing good to people through the different various camps that I've held, being in various committees, councils. And leadership is important in a sense that it trains you about discipline, and surgery is all about discipline. If you can discipline yourself to understand a particular problem and solve the puzzle, then you have achieved half of your surgical practice.
All right. Considering your popularity, when we announced that you are going to be our next guest on Instagram page, so we have received a few DMs from fellow doctors. Shall we take a few of
Of
them?
course, I'd be most happy to take.
Okay, let's go then. So, is surgery the right field for women in Goa?
A very good question. In today's world, we live in a non-gender biased society. I feel that women are equally capable than men in today's surgical practice. Even sometimes, the fine precision may even be better by a woman than a man. I am a man also, but I do consider that it is important for the women in Goa to balance their lifestyle, their family support, okay, and also all the other responsibilities that they have. If any woman is hard bent and has got their focus, determination to catering to all and everything, then they definitely should join surgery, because it's important that the family background, the familial support for a woman, if they are able to convince their family that they will cater to all their responsibilities, there is no problem in taking general surgery.
Great. Next question. How do young doctors manage failures?
A very good question, Roshni. It gives me to think about all my failures. And like I said before, it's how you take on every failure, whether you take it on as a burden or as a learning experience. The learning experience may be as simple as whether you have improperly prepared the patient for surgery, or if you have told the patient a wrong advice. But as a resident, you are empowered with the knowledge that you can make mistakes. So, yes, do make mistakes until and unless it involves the patient's life, and learn from your mistakes, learn from other people's mistakes, as I said, because and your outlook towards your failures should change. If you have been grown up with an outlook of failures, you should not do this, you should not do that, it's not a very good outlook to overcome all your failures. You should be, no, if I have failed, why have I failed? Introspect into every problem that you have failed and come up with a solution towards every problem. And that's exactly how you can conquer residency. Grow through your residency in the sense that you can be a better person once you come out of the 3 years, not only in terms of knowledge, in terms of experience, practice, and also your mindset towards patient care.
Okay. What are the opportunities after doing super specialization outside Goa and coming back to Goa to practice?
A very good question. In fact, the same question has been mind-boggling me for the past 2-3 months. Maybe with dreams or nightmares, I really don't know. That's only time will tell. But I feel that whatever super specialization is there, it all depends on your willingness to get stratified into a particular field, into a particular branch, and whether after doing that, would you like to come back to Goa or would you remain out of Goa? Because in Goa we have a lesser patient load that is important for certain super specialization branches. Like if you see plastic surgery, urology, there is and neurosurgery, there is a growing trend that we have certain patients that require these care. But in terms of very varied things like surgical oncology, hepatobiliary, they are coming up. Yes, not right now, but in due course they will come up. So I feel that it is important to give due importance to these specializations, and also the backbone being general surgical practice should not be forgotten, because who will refer patients to these super specialization? So like for example, me in terms of me as a general surgeon with my interest in diabetic foot, I will definitely refer a patient after treating the patient with his foot care to a plastic surgeon. For example, maybe in aesthetic DNA, we have Dr. Amay Pednekar, who's doing such a good job in terms of his delivery towards the flaps, towards skin grafting, towards certain specialized footwear care that is given, changing biomechanics, and also improving healing to all ways that we can. So it's important that certain people are, that when we refer a patient, that the patient is important and gets the adequate deserving care. So, all having said that, if you come back and are coming back to your general surgical practice, which is also seen that certain super specialists come back to Goa and then they land up doing the same thing a general surgeon does. It's also not a problem, but the only thing is that after so many years of experience, it gives you a different outlook towards the patient care. So a general surgeon's outlook compared to a super specialist outlook will be different, and it is required because you require specialized care, also you require primary care, but specialized care cannot come at the cost of primary surgical care.
Okay, so now it's time for the most exciting segment. Do you want to take a guess?
Rapid fire?
Yes, you know the drill.
Yes.
So, quick
I got
questions.
my coat on.
Yep. Quick questions, quick answers.
Done.
Shall we go for it?
Yes.
Okay. So, one word that defines surgery.
Precision.
Most important habit for a doctor.
Discipline.
Okay. Government hospital or private practice. One learning from each.
Government healthcare center has got a wide load of patients. You can have a lot of things that you can offer in terms of government care, and private practice you can give the patient the utmost time and eccentric care that he requires.
Nice. A message for Goan parents of medical students.
Oh, that is a tough one. Now I have to think about that. Coming to Goan parents, me coming from a background of medicine, my parents understood the struggles that we had in terms of the whole MBBS curriculum and this. But there are multiple parents who are new to all this. So it is important for those parents to understand that MBBS, super specialization, specialization, however long the course is, it takes a toll on the person, on the individual's personal life, private life, familial relations, and even interpersonal relations. He's not the same person that he was when he joined MBBS. And it's important for the parents to counsel and to get to the student to their ward in and give them the support that they deserve and all the encouraging advice. It's not required for them to burden them with more than what they can handle, which we see nowadays in terms of our Goan parents. That it's very difficult that they expect a lot from their child when they equate a simple child from other professionals also to the same child that they have from a medical professional. They are not the same. They have their own drawbacks. They have their own fallacies. They are sometimes sleep deprived, and this is not because of the number of hours in this, but because of the mental and the physical stress and torture that they have compared to other fields which may not have so much. Because at the end of the day, you are dealing with a live engine. So, like a mechanic working on his what you call motorcycle or a car part, a human deals with something that can tick off at any different time and person, and each individual has a different way of working. So, when you are dealing with patients from the ward, when you're dealing with your subordinates, when you're dealing with your colleagues, when you're dealing with seniors, there is a lot of interplay of relationship, emotions that goes into all this. So it is important to understand when this person comes home that he carries a lot of baggage, and that baggage has to be alleviated, not through firing or asking a person to do whatever, but by making it important for the person to grow and giving him the space that he requires to rest at the end of the day.
So, is it safe to say that get into the MBBS and your life is set is a myth?
Yes, because MBBS is, like I said, continuous education till you're 6 foot under or in front.
Yes.
Because it's very important that learning never ends as a MBBS student, as a specialist, as a super specialist. I'm sure even like a mentor of mine, Dr. Arun Bal, he himself says in terms of diabetic foot learning is not over until you land up into the mud. So it's important for you to always think of what next you can do, how well you can better yourself, and emotionally, and how well you can educationally support. You should always have that driving interest towards learning.
Okay. Next question: tea or coffee during the night duties?
Neither.
Neither.
Water.
Okay.
Water is the essence of life, because my personal favorite is coffee, but I suggest everyone requires to be adequately hydrated. We work so many hours, we do not know how much we drink water, when do we eat, when do we sit down also for that instance. So that's why I say neither tea, neither coffee, but water, because water is the essence of life. Water is present in you. Hydrate yourself. In terms of MBBS, MS, wherever you are, always hydrate yourself in life.
Okay. PG life or consultant life?
Right now, I'm in a consultant life. PG life went back, but each of them has its own good as in the bad. Okay, so there's always two sides to a coin. PG life, you have less responsibility, you have the room for error, you can make your learning curve, you have the time for patience, you have the energy. As a consultant, you have to make the grueling decisions. You require to know what is important for the patient and for exactly, because your patient care will completely change how the patient will survive, will live, will have. Because when you make a decision that a patient has to be opened up, like it's always said that the abdomen is a Pandora, and it's a Pandora box. Okay, but more importantly, it is that you should know when not to attach a scalpel to the skin. That is the true mark of a surgeon. Not when you can operate, but when you should not operate. That is what you learn in consultancy.
Okay.
Okay, but we want to know what do you prefer?
Fine, Roshni has really put me in this spot. But in the sense, today, now as a married man, I really prefer and love the consultant life because it gives me the opportunity and the time for family, for myself, and for concentrating on those things that I kept aside during my PG lifestyle.
Okay.
And plus, the wife is happy.
Last one, gender bias in surgical fields. What's your take on that?
As I said before, there is a gender bias, but in due course of time, I think the gender bias is completely becoming equaling towards male as well as female. We do not see a single dominating society right now. In fact, if I relate more that in the newer generation there are a lot of female surgeons coming up, which is a great thing to see because each gender gives its own nature and its flavor to the specialty. So general surgery as a whole requires both a female touch as well as a man's touch.
Okay, great job, sir. So, one value you will never compromise on.
Patient, compassion, and service.
Okay, so sir, before we conclude, we would like to know what message you want to give to the people of Goa, students, patients, and young professionals.
At the outset, initially, I'd like to thank MSc Goa for having me here and the entire team that supports. Because, as I said, like surgery is a sense of teamwork. It is the everyone's contribution that improves and gives the outcome that we want and that we deserve. Similarly, here at MSc Goa, we plan, and I'm sure that is what I was told, is the whole objective of getting everyone integrated into forming a family of medical specialists, super specialists, and even allied healthcare. For taking in and deviating off topic, but I would like to subdivide this question to different aspects of the viewers. Number one, to my patients, I would suggest it is important that to tailor and to understand and every each and every aspect of your disease. It is important that you understand that yes, you have been suffering, how you can get away from this suffering through timely aspects of your diabetic footwear, in terms of getting your sugars under control, visiting the team of the diabetic foot in, which includes an endocrinologist, a physician, an orthotic, a, and a surgeon also, along with the radiologist, allied healthcare, who can get you back on your feet and prevent a further amputation, toe gangrene, and for any other surgical patient that comes, to understand that yes, we understand that you have a surgical problem, we want to treat it, and we will treat it in due course of time. But patience is when you join this profession, MBBS, MS, you should join it having the weight of medicine, patient care, human service, and self sacrifice towards the profession underneath you when you put forward your foot towards this profession. That is what will embolden you to act in terms of patient care as well as improve your notion and your knowledge towards how you can cater to the general population at large and how you can make a difference, because everyone wants to make a difference in everyone's lives. Lastly, to parents and to other doctors that are there, it's important we grow towards a society and a fraternity in which we can be able to rely on each other, not only because of patient care, but because it is important that we require a emotional blanket, a place wherein we can understand each other, because each of us in various professions and in various healthcare have their own problems, from a simple medical officer to a specialist to a super specialist. The learning curve may be different, the number of patients may be different, but each one comes through their own struggles towards patient, in terms of relatives, in terms of their own family. And it's important for us to be mentally prepared for all this and learn how to deal with things on a daily, day-to-day basis.
Thank you, sir. Thank you for this inspiring, insightful conversation. With that, we wind up with the episode. But before that,
Thank you, Roshni, for having me. It was a pleasure.
so we would like to present you with a gift from our sponsors of today's episode, from Aesthetic DNA.
Thank you very much, Roshni. And thank you, Aesthetic DNA, for having given me the opportunity to talk to all our people out there, patients, doctors, and educate them a bit on my experiences and how I feel we can go forward in terms of the medical fraternity.
Thank you, sir.
Thank you, MSc.
So that was Dr. Frazer Rodrigues for you. We will be back with another guest in the next episode. Until then, have a great time.